What's up, everybody? Shawn here with another Live to Roll Live. This week we are back here with, still celebrating our SCI Awareness Month. This week we're going to be talking about bowel and bladder care because that is one of the most important and honestly toughest things that we all deal with after a spinal cord injury, and one of the things you don't realize you're going to have to deal with after a spinal cord injury. We're waiting on Tom. He should be here in a little bit, and I got to fix Bobby's name tag. But let me just do a quick intro. My name is Shawn. I'm a C5, C6 quad from a snowboarding accident. Bobby, you want to do a quick intro while I fix your name tag?
Not a problem. As you're going to be putting it up there, I'm Bobby at Robert Rohan. I think you'll probably put up there. So I'm a C5, 6 quadriplegic 30 some years ago from a bicycle versus bus accident. And we kind of all know who wins that when you hit a handicapped school bus head first. They kind of always win. But let me turn it over to my good friend, Tarina. It's good to have you on the show. Welcome.
Thanks, guys. My name is Tarina. I suffered a T4 spinal cord injury at the age of actually 8 years old. I was in a motorcycle accident with my father. And yeah, I suffered a T4 spinal cord injury. I suffered my spinal cord completely. So I guess that's me.
Yeah, so you're like Tom too. You were on our show for the growing up with a spinal cord injury because you were one of the ones injured very young. Spent most of your life now in the chair. So Trina's got a lot of great experience and stuff, a lot of knowledge with this. All right, so I guess we can kind of just get straight into the topic at hand, and then once Tom is available, he'll hop on with us. I was thinking we would start with the bowel first, just because that's the tougher part, and I think it might go a little longer, and then we can just finish up with some bladder care stuff.
Sounds
Yeah,
good.
so let's just start with the shitty topic first.
Well, yeah, I know that I can say this, that I know this is probably the biggest topic when it comes to knowing your body. Everyone is dealing with the bowel and bladder issues every day. It doesn't go away. A lot of times we can manage it, and sometimes we can have lucky streaks of months and months and no problems, no UTIs, no bowel accidents. But over time, things happen. We eat that one thing that we paid the price for. We're not drinking enough during the summer that you catch that dirty bug for a UTI. And so these are the worst. And so bowel is probably even the toughest because once it's a shitty mess, you're having a shitty day. And to get it under control, I think when we have support groups, it is the hardest thing that people are dealing with out there and just trying to get on that program. So let's talk about a bowel program. The program, just like the word says, program. You got to program your body to go at a certain time if you're going to maintain a regular output. Your body just gets to happen to get up or at night and do what it needs to do at the same time. And you find out that it goes so much smoother. Some people are a little bit different. Some people get that urge and then they know they need to get to the restroom and do it. So that's always a good thing when somebody has that, unless they're having accidents because of it. But it's, for the most part, we're all trying to get on that bowel program. And there's different ways that we all do it. And we're going to discuss each of our ways and how we're doing it and what works for us, because there's certain ways that worked for myself for so long, and there's certain ways, and then it didn't. And then Shawn's on a certain way, and maybe thinking about changes. I know he's discussed that, and I know Tarina and Tom, when he gets here, they have their ways, their feelings. So for me, I'll go first and just say
Yeah.
I did a bowel program for 30 years. And I think at the 29th year, that whole year, I was just getting to a point where my stomach was bloated all the time. Every time I went, I felt like I wasn't emptying out. I would do a bowel program every other day, Monday, Wednesday, Friday, and then try to make that last the weekend a little bit longer, so you don't have to do something during the weekend like that. And I used a suppository, the magic bullets.
Yep.
Everything was great, especially the first 20 years. No problems, no accidents, um, no stomach issues, nothing. And I think it was around 23, 24 years after, little things were happening here and there. It was becoming uncomfortable. I was getting, hemorrhoids that were starting to bleed or ooze at during the day. So I'd get wet down there because the hemorrhoids were starting to get out of control. So not a very fun feeling. And then after 28 or 29 years, then all of a sudden I was feeling like I had to go every second. And then I would do the bowel program. I'd get a big results, and I felt like 5 minutes later I had to do it all over again. Just the way my stomach felt, and it didn't look any better. So it got frustrating. So then I finally made a decision that my wife was trying to talk me into for a few years of doing a colostomy bag. And finally, I just gave in. I said, I can't take this pain anymore. I can't take this constant bloating and pressure and constantly thinking I need to go, and the hemorrhoids problems that were still hindering me from time to time. So I decided to just go for it. And one of the best decisions I made for me personally. Um, it's not 100% proof that I don't have something leaking, because it is a wafer on your skin. It is a little bit tough to get used to when you look down and that's where you're going, and you're like, oh my gosh, now do I have to see this up close and in person? But it's also a lot better that I'm not doing a bowel program 3 times a week for 2 hours. So that was my choice, and that's the way I went. And it's been probably the best decision I made. So that's my story, and we can hear from our guest, Tarina.
Yeah, because I have a
Yeah,
similar story. So why don't we go let Serena go, and then I'll go after.
Sure.
yeah. So, like I said, I was injured when I was very young. So, being 8 years old in rehab, they weren't really teaching me about a bowel program. They were teaching my mother, who was going to be kind of my caregiver at the time. Um, so it took me a few years to really kind of start knowing my body when I started becoming more independent and trying to figure out what worked for me as well. But I personally have always just used basically the method of digital rectal stimulation, and that's just basically, in a nutshell, moving your fingertip around your rectum area, and it kind of that motion stimulates a bowel movement ultimately. And I've been very fortunate that I hadn't ever had to use an enema or a suppository or anything like that. Especially over the last few years, I've gotten a little bit healthier with my diet and whatnot, and that's definitely made a huge difference. I once in a while will have to take stool softener supplements or fiber supplements, um, and a lot of it comes down to really knowing your body and what your normal is. If I feel I'm out of whack, I'll make sure I kind of use those supplements as needed. I always make sure I go the same time of day. It's always at night in the evening, and that always helps in just keeping track of the movements themselves day to day to make sure that you are emptying yourself completely. I personally don't have any sensation down there, so I don't know really when I'm very full. So it's always just kind of knowing like what your normal is, like I said. But that's kind of what's worked for me. Thankfully, I've always been very fortunate in the bowel care. I rarely have an accident. Fortunately, it does come up once in a while when you do eat something wrong or it kind of just goes through you. And I may have an accident maybe a couple times a year, honestly. And that is the
That's
worst
not.
feeling. I
Yeah, no,
know
it's
it's not very
definitely.
often at all. I am so fortunate and I feel so blessed to be able to say I only have an accident a couple times a year. I know it's huge. Um, having a spinal cord injury, I know people suffer with that, especially when you're newly injured, and kind of getting your body regulated and under control. I know it's the most frustrating thing. And like I said, even though I only have it a couple times a year, those days are horrible. And
Yeah, it doesn't.
I feel for anybody that deals with that on a regular basis. So it's tough.
Yeah, no, for sure.
Absolutely,
Accidents
yeah.
can be hard, and especially in the beginning, like it's hard to figure that out. You're trying to get that. You're trying to get your program worked out, like what time's gonna work, what method's gonna work. Um, but that's not bad, twice a year.
Yeah.
But it's not good either. Nobody wants to have any a year.
You
So,
don't
Right,
want, you want zero. You
exactly.
want that one. You want to go that
uh,
zero.
Yeah.
um,
And I think, like
yeah,
I said, I touched on the diet thing a little bit, but that is a lot of it. It's the
diet.
diet and keeping yourself hydrated and the water intake. It all makes such a huge difference.
Yeah, for sure.
Absolutely. I mean, I'm always stuck to a healthy diet, and it definitely pays off. And probably, like you said, that one time a year that I had that, I know exactly what it was. It
Right.
was that thing I ate, and it was going out, and it was, you know, just because everybody else was doing it, I tried it too, and ate a bunch of it, and it's just like, oh, or I just felt really bad. I didn't have an accident, but my stomach was rip roaring and just couldn't wait, and maybe had to do it a day early, like back to back, because I wasn't gonna make it.
I think it's always so funny. A lot of the times I've come across people who are like, I'll complain of having a stomach ache or cramping, or, you feel the bloatingness, and people are like, well, I thought you're paralyzed. How can you feel your stomach pain? I'm like, well, no, I'm paralyzed from the chest down. Yeah, I don't have sensation, but I can feel a stomach pain.
So I try to explain that to people all the time. Like I we can't feel the outside of our body. Like I can't feel somebody push on my stomach. Like I can't feel the touch on the outside, but I can feel
Right.
pressure inside my body. Like they can feel gas in there. I can feel and I don't know if that's part of the AD. Because it is part. I do feel it in different ways. I think, but I don't know. You can still kind of feel that just like when you're really full or bloated. Like I had the same thing. I'll go into mine. I did suppositories for 17 years, pretty much my entire injury. I've been using the Magic Bullet suppository, same as Bobby was doing. And I did the same thing for probably close to 15 of those years, where I did the Monday, Wednesday, Friday schedule and just skipped the weekends. That started getting harder on me, so I just did an every other day schedule for a couple years. And that was hard because it switches every week. One week it would be Monday, Wednesday, Friday, and then it's Sunday, Tuesday, Thursday. So it's hard for care and scheduling stuff. Um, and then even that was still an issue. I was still feeling like, just like Bobby was saying, I was feeling like I just wasn't emptying. Like I'd have a pretty good bowel movement. Like a lot would come out, but I would just still feel like stomach cramps and bloated and not good like the entire day. So I just recently, and I saw in the chat, Peter actually uses it. So I've just recently switched over to the Peristein by Coloplast, um, which Peter uses. And you have to, it's kind of hard to get. You have to go through your doctor, get a prescription, even have them show you how it works. But it's all natural, like Peter just mentioned. It's a water-based enema system. So that's what I'm using now. The suppositories used to take me 3.5 hours on average from start to finish, to where I would actually empty the last bit of mucus out from the suppository. With the Peristein system, I am done in about 30 minutes total, from
Oh,
start to
wow.
finish. And I've been using it for 3 months now, a little more, and so far I haven't had an accident. I mean, I guess I should knock on my fake wood desk here, but like yeah, so far it's been working really well for me. For my body, that natural empty, I'll explain a little bit more of what it is. You can look it up. It's made by Coloplast. It's called the Peristein. Essentially, it has what's called a rectal catheter, and you put that in. It's connected to a tube and a pump, and it pumps a balloon like a Foley catheter would once it's inside of you, so that it stays inside of you and it kind of blocks the hole, and it allows water to fill and then fill up into your intestine a little bit. And for me, I need that plug because my body just naturally wants to force it out. As soon as I start putting the water in there, like I've tried to use enemas and things in the past, which hopefully Tom will make it on here because I know he uses just like fleet enemas. It would just force it out. So with the Peristein system, it actually works. It holds it in there for me. It takes about 5 minutes to get it in and filled up. I take it out, and like 10 minutes later, I'm pretty much done. Sometimes a little bit more. So it's been really good for me because I was actually talking to Bobby about looking into a colostomy and going to that because I was really having trouble doing the bowel program with my suppositories and stuff. So now, yeah, with the Peristein system,
That's awesome.
it's so much easier on my
Yeah,
body. And
I've
yeah,
actually never even heard of that. That's amazing, Shawn.
yeah, see, I had never heard of it either till recently. And I found out about it from a guy on my rugby team, Liam Ricardo, who I play rugby with. He used it for a while, which he stopped using it because he has good results with enemies, which is like a little mini enema, which for people that don't know, they're like these little tiny, I think they're almost like a liquid suppositories from what he was telling me. Not even as much enema. But they are called enemies. And I know a lot of people use them. Anyways, he told me about it and stuff, so I looked into it. And it's just been something for me that's worked a lot better for me. It naturally evacuates my bowels so much easier. And like you were saying, the hemorrhoids, that's actually why Lee started doing it, was because he had to have surgery on his hemorrhoids. And because of the water system, it makes it a lot softer when it comes out because it like liquefies everything as it comes out. So it actually is like a lot, it's actually a lot easier on your rectum and hemorrhoids if you do have them. So it's just something that, is really good for me actually. So I'm just, I'm excited about it and happy I found something that's working for me.
Is that something
That's
you're able
awesome.
to do on your own, Shawn, or is that still something
So
you
that
need
is
a
the
caregiver
one
for?
thing with the suppositories. I used to have help, but I could, using an inserter, do the suppository myself and stuff. I can't use this system myself because you have to get it in while you're already over the toilet because it sticks out of your rectum. It sticks out of your butt, like the end of the stick
It's
in the
it's
tube.
it's kind of
So
hard. It's hard.
so you can't transfer or be having it like in there while you're moving around. You have to be already over the toilet and on. And so for me to reach under and to get it, and then you also have to hold it in there and pump like a little air pump. It's a manual little like rubber pump that you just squeeze, and that fills the balloon. So yeah, for me, I can't hold and like I can squeeze the pump with two hands, but I
Yeah.
can't hold that in there. So, but it's so much faster and easier for me. Like I don't mind. I went from having to have 3-4 hours of care to like 2, and I'm completely done, showered, dressed, ready, everything like ready to go, eaten, like done. Like it's incredible. I've honestly gotten so much of my life back. Like I used
That's
to
awesome.
every other day I would be not done with my stuff until like lunchtime. I would eat my lunch at like 1-2 o'clock because that's how long it took me to finish all morning. Now I'm done by 10:30. I go get some work done. I can go eat lunch whenever. Like it's amazing. um,
That's awesome.
so
It's funny. I did try that Peristein for a couple months. The problem was it kept uh, the water would get in there. Everything's great. The water would come out, and nothing else would come out. Like, oh, come on, man.
so the
It
other
was
thing
just. Go
I was gonna
ahead.
say the one thing I need to do, Bobby, also, and I've started doing it. I've learned from, Julianne, who's one of our other Triumph friends. She actually always, I remember in support groups, talked about the massage she does, like the intestinal massage, and like kind of working from like bottom right up, over, and then kind of down your left side, and like that's the way the intestines flow. And honestly, so I wait about 10 minutes when the water's in there, and then I start to do that massage, and it starts to water flow. And then as the water's going, I kind of push into my stomach and I kind of do my own lean and push like onto my stomach. Like it doesn't naturally want to come out as easy. Like I need to like give it a little extra push from the top. And then that just like at the very end, it just all just like comes out. Yeah.
The massaging of that area does help. I've done that personally for me as well, even before I do my program, where you just kind of feel down there and you can kind of feel your stool, on the outside of your stomach. You feel if you're compacted a little bit once you start kind of knowing your body more. So there is definitely something to that sort of massage to kind of get things moving around a little bit.
Yeah. Do you have problems with catheter breaking before you get it all in there? That's another thing I had. The problem, the balloon would burst.
So yeah, that's one thing that Lee gave me like the advice on. He said like the first time you use one of the catheters to inflate the balloon before you put it in, and like just to like let it expand and like stretch before, and then once you've done that, you deflate it and then you can put it in, and then when you inflate. I haven't had an issue too much, and honestly, I'm not gonna. They recommend on their website you're supposed to throw those away every single time, but right now I actually don't have my prescription for them. I'm using supplies given, like I'm not getting them through my insurance right now, so I'm just kind of getting them, and I'm reusing them because I've talked to nurses and I've talked to people that are using the system, and they say they'll use them for as long as they can until the balloon pops, because your rectum is not a sterile environment like your bladder. It's not like reusing a bladder catheter, sticking something with bacteria back. Like it's not going to introduce infection like that. Your rectum is a bacteria-filled area anyways. So using the catheters over, I mean, I clean them obviously every time in between, but. Yeah, so that's actually one thing that I haven't had too big of an issue with yet.
Yeah, Lee didn't tell me that. He told me everything else, but not to blow up the balloon. So they would just burst inside me. So it was one, you get a big old spasm from it, and all the water comes out, and you're like, oh, I got to start over, and it just like the first two times, I don't know, it was like magic. It was easy. So I don't know. I was gonna go to the chat.
Yeah.
Somebody asked me about, do I still have accidents with the bag? Yes, but they're not like what they were before in your pants, trying to take off your pants. So the accidents are all of a sudden, if I get a whiff, it's because the wafer that's on my skin around, it's starting to lift up a little bit for one reason or another. One, it could be that it's called pancaking. So, your bowels are a little bit on the harder side. So then next thing you know, it's forcing underneath that wafer and it lifts up. So then it's just that's the easy one to change, peel off, clean your stomach real quick. And I can put a new bag on and do that within 15 minutes, if that. By the time you just get everything set up and run, get the bag out and get the supplies out and get a washcloth and soap and wash it up and lay down a towel so the water doesn't get everywhere. And then there are times that, I could have loose and it can start to get under there. So I notice a little leak. But once again, I'm catching it before everything's dirty. I think since I've had it for 2.5 years, I've had to change my shirt twice. Because it got under, I'm wearing my shirt and it's got on the shirt and it's like, oh, darn. So I have to take off my shirt, but never had to take off my pants because of it. So that's a good thing. And then somebody else asked if I still have to do a bowel program for the mucus buildup. Once a month, I do a ditch stim to get 1 or 2 little mucus buildup coming out, and that's about it. No suppositories. No, nothing. It just, we go in there. I have help with that. I'm in the shower. It kind of just plops right out, and then we're done. And I do it once a month.
Nice. Yeah, that's cool. That's good information for people. And that's actually, I mean, that definitely seems a lot better than crapping your pants and having to completely change and
Yeah.
do everything.
And I don't know if you're getting your Peristein stuff. This is where I got mine. And not sure if your insurance is going to pay for it, but I was getting my stuff on YouTube. So a lot of people in Europe were selling them pretty cheap for 100
Oh, on
bucks for
eBay? Or
on eBay. Did I
so
say YouTube? I meant
yeah.
eBay. Yeah.
So I got my pump and everything I got through Lee, which now I'm worried because Peter put in the chat that the pumps wear out every 3 to 4 months for him.
Yeah, they
So
do.
I'm worried because that's the only thing I don't have replacement of. But through Triumph, actually, somebody donated a bunch of supplies that Mark, somebody else from the Northridge Triumph area, he uses Peristein. He's been using it for a few years now, and he's gave me some of the advice. He stockpiles his catheters too. He does not use them one time. Coloplast does tell you throw them away after each use, but that's because they want to sell a whole bunch of those $25 catheters, and they are 25 a piece. So
Yeah, especially when your insurance is paying for it, because Coloplast will not give it to you and let you pay cash for it, and so that's why you have to, use other avenues like friends and finding donations of those, and or going to eBay and finding them on eBay.
yeah, so that's what maybe I'll have to look for a pump on there until I can get. I'm working on getting it through insurance, but it just seems to be a process.
I might have a pump, Shawn. I'll have to check my supplies.
All right, cool. Uh, all right. Well, we can. I don't know if there's any other questions. Maybe I can check the chat real quick too, about this. Too bad we don't. I was hoping Tom would make it for the bowel stuff, so we can hear his.
Yeah,
His.
especially with those enemies or mini me's. So I know we had one fan saying they use the mini enemies and it's instant. I tried
Yeah,
those. It
they didn't work
was,
for me.
it kind of was instant, but it was hot fiery mess. I'll tell you uh, with my
That's base
hemorrhoids.
phase.
Yeah, it was just like, ooh, let's not do that.
Yeah, that's though those didn't work for me. I tried for a little. I actually bought like a whole box of them and thought they would be great and would work, but I don't know. Just for some reason they didn't work for me. So to be honest, I'm surprised that the Peristein worked for me. That's why I didn't go through insurance initially, was because I had so many doubts. I was like, I've tried everything and nothing has actually worked well for me. Like besides the suppository, and that doesn't work well. So like I was just kind of like I was pretty pessimistic about it. And then when the first time I tried it and everything came out and I felt like great afterwards, I was like, whoa, what the heck? Like, so I'm a little worried because I've heard stories like you and a couple people like it worked for a while and then stopped working. So I'm a few months in, hoping it continues. um,
Yeah,
but
hopefully. That would be awesome.
um, yeah. So should we switch over? I guess to some. Oh, never mind. Tom just called in.
Nice, here we go.
Perfect
Hold on.
timing.
Bam, got him.
Hey, sorry.
We were just actually kind of wrapping up we all kind of went through our bowel care stuff. We've been talking, Bobby started with, his, Trina talked about her doing digital stem. I've been talking about Peristein. So yeah, we've covered pretty much a lot of stuff except for the enema stuff. So,
All right, well, that's what I'm here for, I guess. What's up, everybody? I just want to say hey to everybody. Sorry I'm late today. I had someone here doing some work on my apartment, some maintenance work, and then my insurance called, and I had to talk to them for a couple minutes. But yeah, let's talk about some shit. So I do a daily enema, like that's my bowel program. I kind of have like my bladder and bowel routine like wrapped up in one in the morning. Now I do intermittent cath throughout the day, but the only kind of abnormal catheter routine that I have is I have to do a bladder irrigation every day. I have a bladder augmentation, which I my bladder was neurogenic from being paralyzed at a young age, which basically means that it didn't grow to normal size. So when I was a teenager, I was having a really tiny bladder and facing issues like leaking and constant infections and stuff like that. So they took part of my small intestine and they sewed it onto my bladder to make it bigger. They just basically like made a little balloon on it. Now the only issue with that is that the small intestine tissue is made up of these cells. They're called goblet cells, and they generate mucus, kind of like your sinuses. So I have to deal with it's like debris in my bladder essentially, and I have to irrigate my bladder to get that stuff out. A lot of it comes out when I catheterize normally, but does require the irrigation to make sure that it doesn't build up in there, because that can cause a lot of discomfort and issues cathing and stuff like that. And then I go straight from after I cath and irrigate. I have a Hoyer lift, and my caregiver will help me get in my sling, go from there to my bathroom, where use a fleet enema, just like a regular fleet. We usually do like ditch stem to basically like prepare my body for the enema, and then administer the enema. Usually takes between like 15 and 45 minutes for my body to evacuate and do its thing, and then I go straight from there to the shower. Shower up, get dressed, hop in my chair, bing bang boom, there you go. That's my morning routine. And I do that every day. I recently experimented with trying to cut back and doing it like 4 or 5 times a week rather than every day. And I still do that sometimes, but I've had to scale back that a little bit because I just started having issues and it wasn't really working for me. And also like missing the bladder irrigation, I think has landed me in some hot water because I'm dealing with a bladder stone right now and some really serious bladder issues that I think are kind of a result of, maybe not giving it the daily care that I was for a long time. So I tried to change things up a little bit this last year, and it didn't. It just led to some issues, which is very typical of change, right? Things aren't going to smoothly transition. I still do skip my care some mornings, when I feel confident that, my bowel care has been good the last few days and I've been eating light and, like I'm not really worried about having an issue. But it's just, it's a tricky balance. But yeah, that's my care.
Right on, man.
And
That's really interesting that you said about the neurogenic bladder, Tom, of like you being injured so young your bladder didn't grow to full size. I never heard of that. I mean, obviously I was injured a little bit later in life than you. I mean, it was 8, but still, I guess that's a big difference from even when you were injured. I had never heard of that kind of issue.
Yeah, it was really tricky because I spent about 2 years when I was a teenager with like very chronic infections and like some really serious bladder issues, and not many urologists or physiatrists had heard of it. It took going to like 3 or 4 different specialists, and finally I went to the specialist at UCSF, saw Dr. Baskin, and he explained the situation and got me fixed up and really changed my life, because when he did the bladder augmentation, which was required, I did not have a choice in whether or not I got that done. He offered to do urostomy, which is like my catheterizable stoma that I intermittently cath through, and he put it in my abdomen. So it made, instead of having an intermittent cath through my urethra, which was not very feasible for me as a quadriplegic, now I have like a port in my abdomen which I can intermittent cath through, and that's allowed me to be independent with my intermittent cathing, which I don't know a lot of quads that can do that and have success with that, because it's a tricky thing. So it ended up being super, super great and kind of perfect timing. I was like 13 years old, and he was like, "Hey, man, I don't know if independence is on your mind, but you may want to consider this." And I mean, I'm so thankful that he did, because it really changed my life. Like, I went from being very dependent on my mom and caregiver having to cath me every 3 or 4 hours, and I would have to get out of my chair, like pull my pants down, cath through the urethra, do the whole thing. I mean, and it was a pain in the ass at school, having to, leave class 15 minutes early, go on cath. So, it always eat into my lunch and stuff. And, it's such a, bother to me. But after I got that done, man, my life, like, it did a 360 flip. Because I was just able to be out. Like, I could go out with my friends and, go into the bathroom and take 5 minutes to cath. And, I just never could do that before.
Nice. Were you able to immediately start doing it yourself as a kid? Like, you were...
So it was like, no, here's the deal. It was like 6 weeks of recovery. And I went, the catheter had to stay in place for about a month while everything healed. And then went to the hospital. They took out the, one that had to stay in place. And my dad and mom cathed for the first couple of weeks, but I got it to be independent. And my mom was helping me one day, and she's like, "You know what?" She's like, "We got this surgery so that you could do this independently." She's like, "I'm gonna sit back and like let you, I'm gonna watch you try to do it." And I freaked. It was hard. Like I couldn't even watch them like stick the catheter in me. I'm like, "Oh, he's sticking a tube in my belly." Like it seems really weird. But the first time I did it, it was like putting a straw in a Dixie cup. Like I swear, it was just super easy and like wasn't even a big deal. And it took a few minutes extra the first couple times I did it, but after that I never went back. Like my mom never helped me cath again,
Nice.
except for when I still need their help. If I'm hurting or I do get help cathing when I'm laying down in the morning and do the irrigation. Usually have my caregiver help me. I can do it. It's just with the straight cath and the urinal and stuff, usually having extra help is easier. I use a self-contained self-cath system, so it's just like a bag with a catheter that's pre-lubricated that I push out, and the urine flows into the bag, and I can just get rid of everything all together. That's what I use during the day.
Nice. Yeah, so we'll start the transition into bladder here. But real quick,
just on the bowel care real quick though. I don't know if you guys have changed your systems throughout your lives, your disabled lives, but I've changed my system a lot. Like I used to do suppositories like first off, like when I was first injured for about like 8 or 9 years. Then I switched to enemies, which was a mini enema. It's not like the saline solution, it's like this ducosolate solution, which is supposed to be kind of like a mild irritant to your bowels, which can stimulate you to go. And that worked. I had incredible success with that for like 6 years until I got that surgery on my abdomen. And once they cut in my guts, things changed for me. It's just my care was never the same after. My bowel was a lot more sensitive, and that's when I had to make the switch to regular enemas because I was just having accidents all the time from the fleet. But I just wanted to cover the different things that I have done and had experience with, just in case anybody in the chat, is doing any of that stuff as well.
Mention too, I actually didn't really mention schedule. So I actually have also now changed my schedule so that I can have a more permanent schedule. I'm actually doing it 4 days a week. So I do Monday, Wednesday, Thursday. So I do 2 back-to-backs, and then I do Saturday. So it's every other day except for the 2 back-to-backs once a week, which kind of I feel like just helps me clear out a little bit better. And then if anything is backing up through that every other day process, my Wednesday, Thursday is like boom, 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 empty out again, and then I start that every other day for a couple. So that's what I've switched so far with this new, with the Peristein, and that's what's working right now for me. So
I was going to say, have you had success with it? Has it been a successful transition?
So far, yes. That's what I was saying. So far, it has been successful. Comfort's better. Time is better. There's still I'm still trying to figure out little things like the scheduling is one thing I've had to work out. I know that I have to do it right away in the morning. If I wait a little bit and eat more, I get more gas and it's harder. But for right now, it's working great, and I haven't had any accidents. I haven't any issues with it. So
awesome.
Now,
I actually have the Peristein system as well, sitting right next to me, and I'm really trying to kind of convince myself to give it a try, and see if I can transition to that because I don't know, I've just found that the fleet enemas still can sometimes be tricky. They, if for whatever reason, my caregiver can't like administer it successfully, like, I'm just stressed out, freaked out the whole day. The Peristein is great in that, like, it's a lot more successful system because it's designed for quadriplegics, and like to help you like retain, the liquid and stuff, like for the time needed to, have a successful program and things like that. So really, really big pusher of the Peristein, even though I don't use it myself. It's something I'm working on transitioning to. It's just similar with Shawn. I don't have regular access to the supplies that, are required to use it. Now, that being said, the supplies are very reusable. So you can usually make it work if you got to pay out of pocket or, borrow some supplies from, somebody else or whatever. But I think that's where things are going in terms of like regular bowel care for quads and pairs. Like Peristein is probably one of the more successful solutions.
It's because it's also more natural. There's no other drug. It's just water in your body.
Yeah.
Like,
gravity's
like,
peristalsis.
So,
yeah.
I think anything, the least like, added like stimulants and things you can add into there to doing it, probably the better. The more natural you can keep it. Which on that, we had a question for Tarina in the chat, they're just asking if you just use the digital stem, which she does pretty much.
I don't use any sort of NMS or anything. Yeah, and I was to touch on Olivia mentioned something about like being on medications that affect your bowels. I totally forgot about that because a lot of the times, if you're suffering a UTI. And then you're put on antibiotics, that's going to mess up your entire bowel program.
I just went through it.
And that is definitely something that probably affects me the most as far as my personal care. And knowing kind of like how your body is. I always try to kind of up my dose of another supplement I take is probiotics a lot of the time. Or a lot of Greek yogurt, especially if you're on antibiotics. Like to up that as a supplement, and then yogurt makes a world of a difference. And I take probiotics. Yeah, I take probiotics on a regular basis, but especially if you're on antibiotics, your whole system will be messed up. And just prepare yourself for that. Especially being newly injured, I think they just some doctors throw antibiotics here and there, for any sort of infection, but that will definitely affect your system greatly.
I just did the same thing. I started these antibiotics. I just got on like a round of Keflex. It was like some crazy, 2,000 milligrams a day or something of the stuff. And in the morning I do a yogurt. In the night I do a yogurt with a probiotic. And every day while I was taking those pills, and for a week after, just make sure you rebuild that gut health because, you kill all the good bacteria along with the bad bacteria. But you have to help the good bacteria rebuild itself. Like the colonies to repopulate because they really do make a huge difference in your regularity and just the health of your bowel system. Super important.
100% agree. I take probiotics regularly as well.
I cannot miss it.
Yeah, even with the colostomy and stuff, like Bob, you still need to eat the right diet. You still need to take probiotics, do everything for you.
I swear, the more I read online, like the more studies they do, like the more they learn like how important like your gut bacteria is to like the health of your digestive system. It's just like a really, really essential part.
And that doesn't even really have to do with having a spinal cord injury. That really is like all in all, everybody is how they push the probiotics and the gut health for everybody.
Yeah.
I do a probiotic pill, but Olivia in the chat said kefir. I don't know if that's how you pronounce it.
Yeah, it's called kefir.
And there's lots of yogurts that are like manufactured, like, the ingredients are specific to, include lots of probiotics. But so I do the yogurt. Can't beat like the natural yogurt. But I also do take a probiotic pill, which is just a big blast of the probiotics to my system, which I think helps like, support and reinforce the health. Amazon, $5, super cheap.
That's exactly where I get mine too. All right, and then one last question before we move on to the fully talking about UTI and bladder stuff. Any recommendations for pressure relief? And I wish I had some, because that's one of the things. If you can somehow get the gas out of there, it's typically gas in your stomach. Like, if that's what pressure you're talking about, but it's hard to get it out, and it's hard to get it to move sometimes. I don't know about you guys, but
Yeah, I found that's like the further I progress in my, disabled life, I guess, it's something I've had to deal with more. Like I'll eat and afterwards I'll just feel like really my belly's bloated. Or, like I'll just be sitting there drinking and, I'll be swallowing some air and then I'll be like stuck with a belly full of air and feel like, ugh, afterwards. Move your body. You got to move your body around. That's what helps get that air out. I mean, really transfer in your bed. Like, when I transfer and move and twist and turn, like I'll burp and, like your body will, help move some of that stuff around and help moving around. I think that's one of the best ways to go about that. And then I don't know. I've always wondered if like Gas X or like, some kind of pill that like they advertise for that
Bobby
kind of
says,
thing
yeah.
would be beneficial, but I've never taken any, so I can't personally attest to it.
I've tried it, not a lot of results. I know when I'm like on top of my game with the Greek yogurt and the probiotic, and another key thing is lots of fruit. Eat lots of fruit. It makes everything move. I'm not bloating. If I skip fruit for a couple days because busy, just didn't feel like it, it's not a good thing. But plums, oranges, blueberries, cherries. I drink a probiotic. It's a plant-based protein drink every morning with tons of fruit in there. And if I miss it, I know that a couple days later, it's a little bit of a bloating, and it's just like, come on, I call it, I'm having my fat day, because you just know, you're looking at your gut and just going, oh, geez, I know I'm skinnier than this, I know I got a coagulate, but it's just like that bloating is just, there's no relief unless you're eating right and proper and taking, the things that are going to help keep you regular.
And I really can't stress, like, juice is amazing and can be great and like full of a lot of good stuff, but nothing beats natural plant and fruit fibers. Like that stuff is just really meaningful in your digestion and like helping, create like good regularity. The natural plant fiber you get from that stuff is just huge, big game changer.
Yeah.
So
Yeah. And somebody said standing frame. I've heard that a lot, getting upright. That does help.
I've heard that's good for your bowels in general. It just helps your digestion,
Bowel bladder,
and everything.
The body was meant to stand. The body was meant to stand. And so if you are using a regular standing frame program, you're probably not dealing with a lot of this stuff. You're probably having better skin, better of everything.
The thing that helps move our food through our body is this thing. It's this natural process called peristalsis. And it's actually assisted by gravity and, helping pull things down and move them through your body. Now, what we as quads and paras can a lot of times develop over time is a slowing down of our system. Our body's natural peristalsis will slow down, and that can, lead to getting backed up and, bowel impaction and things like that. But, helping support your body's natural peristalsis, like natural movement, is one of the best things you can do for yourself. And that is standing, moving your body, stretching out, getting upright, moving. I can't really stress how important it is to move, and like that really helps stuff move through your body. It's just, the way it works. If you are, very sedimentary and laying in the same position all the time, things just are not going to be able to move as naturally, as they would as if, your body's just kind of expected to be up. So that's why you got to help.
Me and Bobby's little movements like this, and like all my movement I do side to side when I'm driving, I always wonder, I'm like, is this helping my digestion too? Because I am moving, because I know sometimes,
I like to think,
like you said, when
I would love to think so, Shawn, but some days it doesn't feel like it. It's more annoying than anything when you're just like, oh, I wish I could just sit still. And probably people out there that are watching us, just sorry, I've done it since day one. People, it used to be like a movement like this where I'd be like, I don't know what it now. Now it's just straight back. Like
now I got that.
It's hard for any like non-long-term quads to understand the necessity of that, but I have yet to meet a quad that's been paralyzed for more than 15 years that doesn't have like the lean and the shift that they're doing every few minutes, dude. Like it's just part of it.
It's half of it is a blood pressure drop. Half of it is, you're sitting, and so you're just like, especially, I mean, I get done with an exercise class just before this, so I just moved like big time, and now all of a sudden we're stop sitting, and I'm just like, all of a sudden I'm like, oh man, here it comes.
Does Frank have anything like that, Serena?
Yes, it is. Apparently it's a quad thing, so yes. Yes, that quad twitch.
Curious.
The quad twitch.
Also, Louise in the chat, he also mentioned lots of water is key.
I think that's key too.
The body's gift.
Let's use that to transition, because lots of water helps everything, bowel and bladder. Because I know for me, that's one of my... I definitely know that I drink a lot of water before my bowel. I will the night before and the morning right before I go. That was even before using the Peristein system. But I also do that for my bladder, because bladder health, just drinking a ton of water just helps keep it flushed out, So...
It is the best thing you can do if you're dealing with a UTI, is to just try to be a fish for a couple days and like inhale as much water as you can. I mean, just drink. I mean, when I have a UTI and I'm feeling the symptoms, like I will drink literally as much as I can possibly drink and not be sick. And I'll be cathing every 45 minutes, just like clear. But that flushing, and that flow of like not letting, any kind of pee sit in your bladder, because that's what lets the bacteria grow. It's one of the best things you can do if you have a UTI is just drink and pee as much as possible, because it doesn't let that bacteria in the colonies, sit there and propagate, because everything's flowing out of you.
I'm going to give this little tidbit about water. And Mason and I were having a conversation a couple days ago about this, and him and I suffer from low sodium. And it's probably because we drink lots of water. So, we've caused our bodies, to run a little bit on that low side. And when you got low sodium, you get kind of disoriented. You feel fatigued. You just don't feel like your right self. And it's not a good thing to do. So you have to be careful of that. One of my doctors mentioned, don't drink free water. What that means is that free water is, making sure that you have some kind of hydration in there of like a Gatorade or half and half of Pedialyte. Electrolytes. I now I do it about 3 times a week. I take a sodium pill, and that's helped a lot. So it's bringing my levels up to the very bottom of being on that okay side. So that's helping. So you got to be careful with too much water. So you got to be conscious. Like some people are like, do you drink a gallon a day? And it's like, I wish I could, but I know I'm going to pay the price.
Yeah.
That's eat a lot of salty foods. Just kidding.
Yeah, I don't know if I deal with any sodium deficiency.
I've never heard of that.
Yeah, something I'm gonna start to think about too. Maybe if I'm feeling a little funky.
Well,
and I'm drinking a lot of water.
The next time you get a blood test, every once in a while we all have to get a blood test here and there. Ask what your sodium is at. You might be just fine. You might. It's good to know your numbers about a lot of stuff with your blood, especially for an old man like me. I'm starting to have to pay attention, make sure that my cholesterol, which is awesome, so I don't have to worry about that. But it's watching a lot of this stuff and making sure my numbers are correct. And
I think Go ahead, Bobby. Sorry, I didn't mean to cut you off.
No, go for it. Go for it. You're fine.
I was going to say, one of the things that I do, I think, which maybe helps supplement my sodium is I drink a lot of electrolyte drinks. I will drink like water, like regular water, but I'm really big fan of like Propel, Gatorade, vitamin water, which all have a lot of electrolytes, which I think can help, replenish your body of some of that stuff. Help that
Just
like
be
cell
careful of the
transport
sugars
system.
in those.
Yeah,
That's
definitely.
the only
Propel
thing.
is great. It's
Yeah,
no
you want to
sugar.
make sure you go sugar-free. Yeah.
And Propel is like kind of my go-to when I am having a bladder issue because it is just diuretic for me. It makes me pee like crazy. So I'll drink a regular water bottle and then I'll polish off a Propel right after, and then I'll just be like the floodgates are open for the next 2 hours. Having to pee every 30 minutes. But it really helps, and like it's made a huge difference in like my recovery from a UTI. But my bladder's hurting right now, guys. Like I'm really, really down and out, having a hard time. I got a surgery scheduled for a week from Thursday to get a stone taken out.
So you
But
did have a stone.
I do
You
have a
did.
stone, man.
I knew that was what had to be, cause yeah, man. Just when you have like prolonged UTI and that irritation, even after antibiotics and stuff, like it's only like, I mean, it could be something even probably worse, but the stone is like, yeah,
Yeah,
you gotta be
it's pretty
careful.
gnarly. It's been causing me really bad dysreflexia all the time. Super, super serious discomfort. And I'm trying to figure
And be
out.
careful.
I
Yeah.
got
Yeah.
And I don't know, it sucks. Like I have a urologist. Like I don't know. I gotta share this story. I went on this last Friday to the urologist, and he came in. I had my appointment at 3 o'clock. Was talking to the nurse. The doctor came in. I checked my phone. It was 3:28, and he left the room at 3:30, and gave me like almost no information in regards to like the results of my ultrasound. Like he said I had a stone. He said I could schedule like the procedure to get it taken out with the nurse, but then he just bailed on me. And like it was like a whirlwind. Like I didn't even have an opportunity to ask any questions about the procedure. What it's gonna mean. Like apparently I have to be put out. Like I don't know how they're gonna go in and get the stone or whatever. But I've been like all week this week been like following up and trying to figure out if I need to, maybe see like a tertiary specialist, like a urology specialist that's maybe like a higher grade above, whoever I'm talking to right now, and just trying to figure out the details of the procedure. But I'm super freaked out and super nervous about it and super scared about being put under, at a hospital, in which I'm not very confident in their anesthesiologist team. But at the same time, like I cannot wait to get this stone out. Like it's causing me such severe discomfort every day. Like I don't know if I can wait. So I'm kind of feel like stuck between a rock and a hard place with like a doctor that I'm not confident in, a team that I'm not confident in, but like being forced or pressured into getting a procedure, that I have to get done. So I'm trying to work all this out, but man, it's just a lot of stress, a lot of stress.
Sorry to hear that.
Trying to figure it all
Olivia,
out.
yeah, Olivia mentioned she just had to have surgery to remove a bag of stones. She was super septic as well, and yeah, she says to do a yearly cystoscopy, which is probably not a bad idea for a lot of us, but for me, that's getting put under as well. So it's like, I don't know. It's hard to want to do that on an annual basis too.
Yeah, I
Just,
mean the thing is like I'd be down for whatever regular annual thing if it meant not having to develop this again. What is really just weird about my situation is I have the urostomy, which is like my main port to my bladder, and I had when they first did this surgery and stuff, I was still leaking a lot through my urethra. So they gave me, I don't know if it was Botox, because I swear it wasn't Botox, but it was like a one-time Botox thing, and that's what they told me. They were like, "This is similar to Botox, but you won't have to get it annually." And they dilated my like the sphincter to my urethra, like that connected my urethra to my bladder. So I don't leak through there anymore. Like if I have full bladder, 800 cc's, like my head's pounding, like I'll leak a few drops out of my urethra. But like that's the most urine that will pass through there. And this guy wants to go and do like the surgery through. He said that he was going to do it through my urethra, and like that just doesn't make sense to me. And I asked him, I'm like, "Do you have a copy of my medical history?" And the homie doesn't even have a copy of my medical history. And I'm like, "Bro, what the f are you like doing here, man?" Like, he's like, I'm like, "What if we get to the 23rd and I'm doing the procedure, and you can't access it?" I'm like, are you gonna mess up that area? Am I gonna start to leak and stuff if you go through there with a freaking tube to pulverize the stone? And I just don't know. Like, I literally am just like, don't know. I'm supposed to have another phone call with this guy tomorrow, and I just got in my medical records so he can look in my like history and see what's going on. But I tell you guys, man, like, I'm so freaking nervous about this doctor and this situation. Like, I just don't know what to do.
Well,
yeah, that's a little scary, man.
You might want to talk to Olivia and see who did hers, and maybe you can get a second opinion ASAP.
I got a referral to a urologist over at UCLA.
Okay.
But the problem is they don't want to see me until the end of October, and I can't wait.
Getting into doctors' offices these days
it's just impossible. It's insane. It's insane. But I'm working it out. I'm trying to figure it out. I am seeking the additional opinions, and I'm not just like gonna gung ho like let this guy that I'm like at the currently not super comfortable with put me out and start doing things to my body. I'm gonna definitely try to figure out the best place I can go. My alternative, and maybe tell me if this sounds crazy, is if things get bad enough and I'm feeling shitty enough, I'm just gonna go to the ER at UCLA.
That's what I was going to tell you. That's exactly what I was going to say.
Like, admit me, baby. Like, let's go. But it's just, I don't feel like I should have to do that in order to get, urgent care. But, maybe that is what I have to do. But I'm talking to my mom about it.
When you have when you have your next bad day, just do it. Yeah. If you're not trusting the doctor and it's hard to get in, I would just do whatever is extreme for you, especially you've been going through this for 3, 4, 5 weeks now, and something's got to change, Tom. And sometimes we have to take our actions in our own hands.
Yeah, I think we got that actually in the chat earlier from Angry Quad. It said your health is in your own hands. We gotta, no one else. You gotta take care of it. But
absolutely,
dude, like you're saying, but you like it's sometimes like Tom is trying to take it in his own hands and having issues with doctors and things. But dude, I honestly, if it comes to it, I would do the UCL. I would just go to the ER, man. And
I mean, that's what I talked to my mom about it, and she's ready. Anytime I want to, she said she'd just come down and go with me and stuff, and I'd figure it out. But it's just it all makes me nervous. It's all pretty hard, and it's kind of hard to like coordinate and figure out like when you're feeling like shit, like constantly dysreflexic and constantly like down and out. But I'm figuring it out, and I appreciate the love, you guys. Thanks for the positive support. I swear, I was feeling real bad before I got on here and started talking to you guys, but something about this just makes me feel better. I don't know what it is.
Yeah, dude, for sure, man. And real quick, I'm just gonna I actually can't do the cystoscopies in the office because my spasticity and AD are just too high. We've tried it; it doesn't work. I have to be put under.
That's what the guy told me.
Because I was gonna chime in about that one because I get a cysto every year and then a ultrasound.
They said they do them in the office for a lot. Shit. I mean, I have bad spasms. Like that tipped my desk up a little bit right there. Like that literally lifted the desk. Like, but so like I've tried. They tried like, and they just can't even get in there without my AD spiking like too high to where they're just like, it's unsafe. And
so that's my situation. Is I asked the guy. He was like, normally we would do the cystoscopy and like go through the urethra and navigate some of this stuff in the office, but he was like, we can't even do the preliminary stuff for you without putting you out. So that's why they want to just like take me to Holy Cross and knock me out and do everything, but we'll see.
Yeah, man. Hopefully it'll all get taken care of, bro. I hope so. Have you guys had any issues like that in the past, Trina or Bobby? Have you had to have any major?
I've Yeah, no, I've never had any sort of kidney stones or bladder stones or anything. I'm definitely an avid water drinker, and I think that makes a huge difference. I have just an indwelling Foley catheter that I've had since kind of right after high school, and that helped me kind of regain a lot of independence, and it was just something easy that I didn't have to think about. Just go to the urologist once a month and have them change the catheter, and that's kind of how I've managed my bladder care. I'm pretty lucky enough. I don't even really get UTIs very often, and I'm a little on the against antibiotic side because I hate putting that kind of stuff in my body a lot of the times. So if I do feel some sort of infection going on, I know my symptoms and I know my body well enough where I will literally just chug the water and really flush out my own system. And usually it works, and I know better when it doesn't work that I do have to go to the antibiotic route. But I'm really just trying to stay as natural and know your symptoms and kind of know what your expectations are for your own health. But that's kind of what works for me.
Yeah,
That's
I haven't
cool.
had I haven't had those stones. A doctor told me this 25 years ago. He looked at my chart and just reading, and he goes, "So you said you have a soda every so often?" I go, "Yeah, so, here and there." And he goes, "Stop. You want kidney stones? Stop drinking soda. Period. Stop drinking it. Never had a problem." So I don't know if it's it's just one doctor that told me. And I stopped. I don't enjoy sodas anyway, so it was just something. They said lots of people who drink lots of iced tea, I think it is, and lemonade, and so you got to be careful with some of the products you do drink a lot. I'm like you, Trina. If I have a problem, I just down a little bit more water if I'm feeling my symptoms.
Yeah.
I even now have a IV guy who comes to my house, and I get a banana bag and flush it through my veins, and that always
Really?
helps because that flushes everything out, and I get the vitamins, and I feel like a champ after. And I
I've heard
I
about
haven't had
that,
a
Bobby. I've wanted Yeah, that's cool. I've heard about that.
Are
yeah.
you
All right,
doing that
So I
like
got a
every
guy.
night of like
how do we
heavy
get
wine
access to
drinking?
an IV drip over here?
It's they're easy to find.
Yeah.
You can go to places like that, and it's not cheap. It's $150 a pop, but
Yeah.
I'd rather pay $150 and not get a UTI. Because there was a time, I did have a bad UTI for that went septis, and I was seeing some strange things. It was the worst thing I ever went through. So now I'm on methamphetamine, so I take that as a daily, twice a day. It's an old, not antibiotic. It's
It's like a kind of a probiotic for your bladder. It's like a
it's like a
it's not an
probiotic. Yeah.
antibiotic, but yeah, it's a. I actually have been taking the same thing. I do it morning and night, and then I also take. Somebody just put in the chat down here.
The
D-monos in a ton of water. I do the
D-monos, yeah.
D-monos as well every night.
Yeah.
And that's just a cranberry extract for people that don't know. It's like a sugar extract from cranberry that's specifically just very good for your bladder.
And for anybody that's not really familiar, what that is actually doing is it just helps balance the pH in your bladder, which doesn't allow for the bacteria to exist. Like it can't survive at that, like level of pH or whatever. The D-monos helps, create a certain environment in your bladder that doesn't allow for the bad bacteria to survive. And you get that just from eating cranberries or drinking the juice, the real juice, not the ocean spray, sugar, watered down crap. You gotta get the Trader Joe's
like
cranberry extract, and
the
let me
real.
tell you, it's not great, but
I was
you
gonna
gotta
say
drink it.
real cranberry juice does not taste very good. Like pure cranberry,
No.
it is not not very tasty.
Unless you got a lot of vodka in there.
No, it's funny. I was texting Olivia. She was talking to me like a week ago, and I was like, "Yeah, I'm drinking this cranberry extract from Trader Joe's." I'm like, just mixing it with some like fizzy water, like some LaCroix, like pretending it's like a virgin like vodka cranberry tonic, like or something,
Nice. Yeah, you gotta do what you gotta
And
do,
Mason,
man.
I think Mason was asking me. It's $150 when I do it,
For the IV
And Mason,
treatments.
you said you thought I lived in Northridge. Can you go to Northridge Hospital? I do live in Northridge, and I probably could if I wanted to. The urologist that is doing my procedure, though, he contracts out of Holy Cross, which is another hospital here in the valley. Which honestly, I've heard some nightmare fuel about quadriplegics staying there. But it's a outpatient procedure, so hopefully, I'm not going to be admitted. If I do, that means something went wrong, and that's probably not a great situation. Um, Now, I could maybe just go to the ER over at Northridge. I've been to the ER at Northridge several times, not for myself, but with someone else, and it's not been great service. It's
Not what
not
it used to
really
be, is what I
awesome.
heard.
Yeah, not really the place to go, I think, for some of these more complex issues. And I don't know, it's just like kind of the trend with emergency room staff and doctors. The reason I feel confident going to UCLA is just because they have the specialists, like, working there. And I have a better chance of being seen by someone I think I have some confidence in versus going to Northridge. No shade against like the Northridge urologists because I'm sure they're great, but I went to Northridge Urology like 6 years ago, saw Dr. Pereira, and ended up
That's
in
my
the ER
urologist.
with super crazy AD because she tried to scope me in the office, and my body just said nope.
See,
And
that's probably
she
why she
told
won't do me in the office, because that's who I have as Dr. Pereira as well. And so that's what, as soon as I started mentioning AD and she started it, she's like, all right, no, we can't do this in the office. That was probably because of the Tom experience.
dude, my mom was with me when it happened, and my mom was not happy, and she was pretty freaking upset. And they tore my urethra with the
Oh my
scope.
god.
Yeah,
Wow.
yeah. So it
Yeah.
was gnarly. It was
Hey guys,
not cool.
unfortunately, I know you guys probably have about another 15 or 20 or
Well, we
probably
can.
another
I was gonna
hour
say we're going
talking
pretty
about
long
this.
here, but
I didn't want to rush anything. Unfortunately, I got to get going. I got a coaching session that I coach someone on a project. So unfortunately, I have to go. So if you want to just leave that up there and you guys finish naturally.
yeah, well, we'll start to wrap up anyways. We can wrap it up.
Okay.
We're already going kind of over. Um, and then if people have more questions, you can always reach out to us. And Bobby, I got you covered on the bladder because I got the super pubic, and I think we have a pretty similar
Yeah.
experience and
Yeah.
and stuff. So no worries,
Absolutely.
man.
No problem.
So we'll see you later then if you got to go.
All right. Thanks, Trina,
Lots of
for
love,
coming
Bobby.
in and joining us
Bye.
today. Great having you. All right. Tom, you take care. Good luck, bud.
Thanks,
All right,
man.
Bob.
Appreciate it, dude.
See you, man. All right, so yeah, we can get into we've already kind of covered what Tarina uses a Foley. You've talked a little bit about your setup. I'll get into briefly what me and Bobby use, which is that super pubic system. And the super pubic, for people that don't know, is a surgically placed indwelling catheter, similar to a Foley, but it's actually placed in your belly. So they do a stoma directly through your belly that goes straight to your bladder, and then you have an indwelling catheter that stays emptying to a leg bag or a bed bag at night or whatever you want to use. But that's what I use, and for me, I change it every 3 weeks. I used to flush it every other day, but recently I've stopped because we had this presentation with Triumph and a nurse came on talking about how that actually could be introducing more bacteria than the good it was doing. So I'm temporarily taking a break from that. But I do have a lot of sediment and stuff, so the flushing keeps any sediment from building up and blocking the catheter, which I have had issues in the past of. And I had issues with bladder stones my first 2 years. And luckily, I honestly don't even know what exactly I changed. Maybe drinking more water, maybe... I know I do drink less soda. I wish I didn't drink any, but I do drink like one, and I don't even typically finish one can a night, like for dinner is all I usually do. And I drink a ton of water throughout the rest of the day. So maybe that's what it is. I think when I was younger, I used to drink more. But yeah, I used to have to get the cystoscopies regularly, which for me even then required going in, getting put under. They'd have to blast stones. And I pretty much typically once a year had at least like a stone or two that had accumulated for the first like 3 or 4 years, I think. And then they stopped. I don't know why or what, but I am grateful for that. Sorry, Tom is dealing with it.
I made it 24 years. This is my first stone. I
That's good.
stopped doing my daily irrigation with my bladder, which I think, because of the mucus that builds up. At a certain point, it'll kind of start to calcify and like harden, which I think maybe like a little seed of the stone started, and like it just went from there. It got to the size where it couldn't pass through my catheter, and then over time it just built up and got bigger. But let's stop talking about that abnormal stuff. Just to give you guys a little rundown of my cathing situation. I already talked about it earlier. I self-catheterize intermittently through a urostomy, which is just like a port in my abdomen that was surgically placed when I got surgery when I was like 13 years old. And they took part of my small intestine tissue, they built the port, which I catheterized through, and then they made my bladder a little bit bigger in the process. It's awesome. It doesn't, it's really weird in how it works. So it's like tissue that is just like almost like your urethra. It's just like this, access to your bladder, right? But at the end of it, there's a little fold in the tissue, which I guess they somehow do purposefully, which when your bladder is full, the pressure from inside pushing out closes that fold and doesn't allow urine to pass through and leak. So it doesn't leak. I did have some issues with leaking early on, which I guess is super normal for the procedure, but over time that stopped. And I'm able to intermittently cath regularly. I do it every 3 or 4 hours, as needed, sometimes more frequently, sometimes less frequently. The reason I didn't want a suprapubic, I have hypersensitive bladder, and any kind of indwelling stuff. I've had Foley's before, like long term, kind of like what Trina does. I've had Foley for, a month at a time. It irritates me really bad. I can't move. I can't transfer without crazy spasms, crazy hypersensitivity. Like the inside of my bladder is just like, doesn't like it. So that's why I opt for the intermittent, and it's really worked well for me. It is kind of a pain in the ass to have to cath, like every few hours. But everybody's got to pee. I get jealous of Shawn because he just has to go empty his leg bag, real quick and easy. But and mine's like just a few more minutes and a little bit more of a process. But it's so quick and it's so easy, and I'm so used to it now. After doing it for 15 years, it's just nothing.
Yeah, dude. So I was gonna ask you too. How often do you have to do every few hours? And then at night, what do you do for people that don't know? Like, what do you do
I keep
a
couple catheters in bed with me, and if I gotta pee, if I wake up and I gotta pee, I'll cath in bed. I have a bed that I can sit up and I'll just catheterize. I don't keep anything indwelling overnight. It's just like most people. You gotta get up and pee in the middle of the night. Most mornings I wake up at between like 4 and 5 a.m. and have to cath. And it's just, I'll be a zombie for a couple minutes, cath, half asleep, and then put the cap back on the catheter bag, position it in my bed so that, it doesn't fall over and, leak or anything. And then I'll either take care of it when I do finally get up and transfer if I don't have care that morning, or if I do have care that morning, my caregiver will just help me take care of it. And then I'll catheterize again and irrigate, before I do my bowel care. That's usually, I don't know, I'm an early bird. My caregivers show up between like 5:30 and 6 o'clock. So I sometimes can just make it, if I, I can force myself to make it by just not drinking too much when I lay down. But for some reason, when I get in bed, like I have to have a cold water bottle with me, and I like to drink cold water when I'm in bed. I don't know why. So I usually have to cath in the morning, and I usually cath twice. Once a little earlier before my caregiver shows up, and then again when my caregiver shows up. Nice.
Tarina, with your Foley, do just probably the same as me, use a leg bag in the day and then switch to a bed bag, or what do you? How do you?
Yeah, I actually don't even change to a bed bag. I
Oh,
just don't like the idea of having to take it out, and I just feel like opening it up like that kind of reintroduces bacteria. So I really time my water intake to like an hour before I go to bed. I usually don't drink anything, and I usually can make it through the night. Once in a while, I will wake up in the middle of the night and I feel it, and it's a little full, so then I have to just make sure I have a urinal next to the bed and empty it or whatnot. But yeah, I just don't like opening up the Foley catheter itself to put in a leg bag, but or a night bag. But yeah, I just use a normal leg bag, and I personally just wear it on the same leg all the time. I know some people switch legs to make sure it doesn't
I
cause
do
any
the same leg
irritation, but
too. I don't switch either. So
I can't switch.
Hey,
It throws
sorry to
me
interrupt
off.
you guys. I gotta turn my camera off for a second. I have someone knocking at my door. I might just
No
mute.
worries, Tim.
okay,
But yeah, I always
we
use
can.
the same leg, and yeah,
Yeah. So okay, so that's cool. That's I always use the same leg too. I'm just typically
yeah,
like it's just easier for me. I don't even. I don't know. It would be weird to be switching it back and forth. But the one thing I
right,
do is I take it off at night. So like I use the bedside bag at night because I can't empty it during the night. I don't like even with a urinal. It would be so hard to do for me.
yeah,
So for me, I can put the bedside bag on and just have that going for the whole night and just not worry about it. And it's it's just easy. But
yeah.
that's
That
cool.
totally makes sense.
Yeah, no, that's cool. Like as long as you have the system that works. And actually, from what that nurse that we had that presentation said, that's actually much better. The way they even she actually suggested, and the way that I've seen videos suggested different systems, is they make like the leg bag that the bed bag can like hook to the end of, so that you basically never take the leg bag off. You just open it and it connects to a larger drainage bag that you can disconnect later. Like, so that's one way that I've heard that you can get around that is if you can somehow, I think they have some systems where you can hook up like a drainage tube to the end of your bag. So it's like
Yeah.
not actually detaching from your catheter and never actually like introducing bacteria in there. I don't know. That's just an option that. What's up?
Sorry about that, you guys.
Yeah.
Cool, man.
I got a bunch of work being done on my apartment right now because it's not meeting minimum quality of living standards.
Oh man. Yeah, bro. Get fixed up. Maybe that's why you
Yeah.
got bladder problems.
Yeah, dude. Well, it's just like yeah.
Environment.
I'm not gonna get into the apartment stuff. That's a whole other podcast, which we got to do, dude. We haven't done that topic yet. Independent living or like apartment living or just home living as a quad. It's that's a real topic right there.
Yeah. No,
And
that's
Good
yes,
good.
idea.
lots and lots of rubber gloves, tons and tons of gloves. Peter, can't stress it enough. Always glove up. Got some nasty hands, people.
Yeah, dude. Yeah, that's I think key for anything, especially if you're cathing. And bacteria is definitely your biggest enemy when it comes to the bladder stuff. So anytime you're introducing any type of bacteria, you're opening up infection. So like the
Now,
door to it.
I do the intermittent cath, so I'm constantly touching my catheter, every couple hours. I always make sure to hand sanitize and or, um, wash my hands if I have access to, warm soap and water. That's not always the case though. Sometimes you just gotta go. My self catheter kits come with like an iodine package, which I don't use and have never used to sterilize the area or sterilize my hands. Um, I I don't know, like for a time, I don't know, like I'll be honest with you, sometimes I don't even wash my hands before I just, grab the self cath and start to go. I was told by my urologist like this crazy story about this guy that kept his, straight cath like wrapped up inside his shoe, in between his shoe and his sock, and like he used that throughout the day. And he
Oh
said
my
that guy had
gosh.
one of the healthiest bladders he'd ever seen, and had no chronic UTIs or anything. Now I'm not advising that. I'm just wanted to make a point that It is easy to introduce outside bacteria. E. coli bacteria is the one that can really take hold in your bladder and cause major issues. That's the most common bacteria for UTIs is E. coli. And that can come, from lots of different places, but, especially if you're, have issues with your bowel program or, doing your bowel and bladder care at the same time, it's just super, super important to make sure that, you keep the sterile fields and maintain, gloves and, just do your stuff. Now, gloves aren't an option if you're independent quadriplegic with no fine motor control. I can't put on plastic, gloves, period. It's just not possible for me or feasible or realistic. So I think that's great when you can, but not all of us can. And I do a lot of my care myself and just do my best, wash my hands, take care of myself. If I do see any sign of infection happening, I do what Tarina does and start to chug water and try to flush and, just catch it before it gets bad. And yeah, you just have to really pay a lot of attention to your body constantly. Watch these things and, look at your pee, make sure that it looks healthy and stuff. When you empty your bags, make sure there's no strong odors and things like that. Just pay attention to all those signs. You see any sediment or anything, you just, all right, I'm in drinking mode,
Yeah, that's one thing. Just pay attention to your body and learn, you really got to learn yourself and learn signs. And
we talked about soda. I recently stopped drinking alcohol. Just because every time I did, it was making me sick, making me feel like shit. Now I'm thinking that's because I've been having some, regular bladder issues going on and stuff, but just be smart, alcohol is not, it's probably worse than soda in regards to, fluid intake and stuff. So just be super, super mindful of, what you're putting in your body and how it might affect you.
Definitely, man. Good advice for everybody. And yeah, I think that's...
But, you still got to enjoy your Friday night cocktail. Go for it. Just don't do too
water.
many.
And then drink a bunch of water. If you're going to go out and drink, maybe make sure you have your D-Monos at home and a bottle of water to chug before you... after your night of drinking.
Yeah.
That might help.
Yeah, no doubt.
All right, let's go ahead and try to wrap up here. So we'll finish like we normally do. Tom, you usually ask our guests.
Yeah, Tarina, this is kind of how we have been wrapping up the show for a while. It doesn't have to be. It can be advice on this topic. It could just be general life advice. But we always just ask if you have any words of wisdom for our viewers or anybody watching out there. What's Tarina's?
Wisdom,
Yeah. What's Tarina's words of wisdom? What helps you, get through life? If you could give any advice to anybody out there living this, spinal cord injury life, is there anything that pops into your head, that helps you get through your day to day?
Honestly, I think it's just keeping yourself motivated and busy. For me, I'm a very busy person. If you know me personally, I like to stay busy. I like a routine. I like a schedule. And always kind of something to look forward to. I know, especially as we kind of move out of this COVID world and things are kind of opening up, there's more and more things to look forward to. And sometimes, especially being newly injured and having an SCI, it's just you kind of live this mundane life, and there's always something to look forward to. It kind of gives you a little bit of hope and positivity. So I guess
amazing, awesome. Awesome advice. And yeah, totally. Just to kind of confirm and reiterate, that's one of the things that helps me function. And when I'm being down and out is, I'll invite a friend over and just have them, distract me for a couple hours, I'll force myself to go out if I'm feeling kind of funky and down and out. And, it can be hard when you're feeling tough, but I'll tell you what, once you're out and you have that distraction and, you're able to, occupy yourself and occupy your mind in a lot of ways, it just really helps me deal with my pain and, some of my body struggles is, just by keeping myself busy and distracting myself.
Right.
So amazing advice, Tarina. That's super awesome. I love that.
Yeah, for sure. That's great. Honestly, that helps anybody, I think, disability or not.
Yeah.
Let's shout out everybody in the chat, everybody viewing. Thank
Yeah,
you so
thank you
much for
guys.
joining us. I'm sorry I was a little late today, but thank you to Shawn and Bobby and Tarina for being awesome and amazing, getting the show started. And big thank you, shout out to Shawn, our illustrious producer and creator of Literal. None of this would happen without you, man. So thank you, bro, for making all the magic.
Yeah, no, thank you,
Yeah.
dude. Thank you for joining us, Tarina. Thank you again for
No worries.
joining. And
Yeah, we really appreciate you being here today, Tarina. You were one of our first
No
guests we
worries.
had on, so it's so awesome to have you come back.
Yay.
Yeah, definitely. We really,
and
No,
really
glad
appreciate
to be
it.
here, guys. Yeah.
and like always, we'll be back next Tuesday for a new show, and then also we have
We got the
Brianna,
lady
the
show.
women's show on Thursdays, which is this Thursday. Brianna will be on with the regular girls, so don't forget to
And
check that out.
Brianna
We'll
is
take
awesome, and
names.
that show is always so freaking entertaining. So go and check out that, especially if you know any ladies out there with spinal cord injuries and stuff. I always think it's such an amazing thing to have a space, where women can just talk about women. So make sure to check that out and spread it around to anybody who you think might be able to, enjoy it or get some use out of it.
Heck yeah. All right. Yeah. Thank you guys for watching. Thank you, everybody, for joining, chatting, all this stuff. Like, subscribe, all that stuff, guys. Live to roll. We'll see
Yeah,
you
make
next
sure to
time.
comment and like.